welcome to our show, Health and Wellness, Myths versus Facts. I'm Gargi Rawat. Now, the number of individuals affected by pre-diabetes is increasing rapidly in all areas of the world. The prevalence of pre-diabetes in India is often underestimated. The majority of people who have pre-diabetes don't experience any symptoms. So there is a large population of undiagnosed patients. Now, having pre-diabetes means you're at increased risk for developing serious health problems such as type 2 diabetes, stroke, and heart disease. Pre-diabetes is very treatable, and that's the good news. And if you have it, there is a good chance that you can prevent or delay type 2 diabetes by making changes in your diet and increasing your level of physical activity. A better understanding of pre-diabetes could help with earlier identification and thereby allowing earlier intervention, also potentially lowering the number of individuals who go on to develop diabetes. Now, there are lots of myths and queries about pre-diabetes, and today we have with us eminent endocrinologists who will help us understand this much better and help you, plan and have better health and identify pre-diabetes. We're joined by Dr. Dheeraj Kapoor, Chief of Endocrinology, Artemis Hospital, Gurugram, Dr. Abhijit Bhograj, Consultant Endocrinologist, co-founder 7sugar.com, and Dr. Vignesh. Dr. Vignesh is Endocrine and Diabetes Center, Trichy. Thank you so much, doctors, for joining us to talk about this, very important issue when it comes to health. And given that India has such a prevalence of diabetes, it's very important to be able to identify pre-diabetes. So, Dr. Bhograj, if you could just, tell the viewers what is pre-diabetes and the fact that it's very prevalent and which, it's affecting younger people as well.
Yeah. Yes, madam. So the prevalence of pre-diabetes or, diabetes which has not been diagnosed, we have almost more than 70 million Indian in this category. And so that is the kind of prevalence that we're dealing with. And when you talk about younger individuals, we are starting to see diabetes or pre-diabetes even in a population as young as 15 to 20 years. And so this is the kind of challenge we are facing in India. And this is something that needs to be taken in a war footing and assessed and evaluated.
All right, we will go across to Dr. Kapoor. Dr. Kapoor, to ask you that same question regarding, pre-diabetes and how prevalent it is, if you could explain to us.
So when we were students, we were told that anyone whose parents were diabetic is a pre-diabetic, but that doesn't hold true anymore. It's a biochemical diagnosis wherein the fasting sugars between 100 and 125, and after glucose sugars, glucose 75 grams and sugars after 2 hours, it is 140 to 199. Now, after having food, there is no academic diagnosis for pre-diabetes. Pre-diabetes across various studies in India is somewhere between 10 to 14%. I would put it at 14%, which means that the sugars 100 to 125 or maybe 140 to 199 or both. So that is the prevalence in India as it stands today.
All right, Dr. Vignesh, now if we talk about, prevention of developing full-on diabetes, if left untreated or ignored, how long does it take for a pre-diabetic condition to progress into full-blown diabetes?
Yeah, it is a very important thing to know. So the most important thing is that pre-diabetes over a period of months or years, it can progress to full-blown diabetes. It varies with person to person. Generally, it is said 5 to 10% of pre-diabetes progress to diabetes every year. And overall, approximately half of, 50% of pre-diabetes may become diabetic in 10 years duration. And those people who have a higher BMI and relatively higher sugars or higher HbA1c are more likely to progress to diabetes. And people who follow a sedentary lifestyle have higher chance of progression. And there are some studies to say that women are more likely to progress to diabetes than men. And most important thing is that a lifestyle intervention will prevent a pre-diabetic person or will delay a conversion of pre-diabetes to diabetes, and to some extent it can also help to reversal of pre-diabetes to normal glucose tolerance. And if somebody is smoking, who is a smoker, so there is a high chance that he has progression of pre-diabetes to diabetes in them.
All right, now, Dr. Kapoor, is it true that most people get diagnosed with pre-diabetes during a routine checkup? And also, could you tell our viewers if there are any, signs or symptoms that they can look out for that will indicate that they may be pre-diabetic, and they, then can take certain actions, and this will help in early detection?
So when we were students, we were taught that diabetes presents as polydipsia, polyuria, polyphagia, and weight loss, which means weight loss, lots of urine, lots of hunger, and of course, lots of thirst. Now we've understood that 60% of diabetics might not present with symptoms. So expecting symptoms in pre-diabetes is not on, which means that pre-diabetes does not have any symptoms. Most, in fact, all of them are diagnosed as a matter of routine checkup or checkup for some other antecedent illness. However, we must understand that there are certain warning signs. For example, a bulging belly, darkening of complexion in the neck area, in the armpits, the underarms, or even at the elbow, the upper part, which is called the popliteal fossa. Dark called acanthosis nigricans is a very valuable warning sign for diabetes to happen. Something called skin tags. Now, these skin tags are common in the neck area and also under the armpits, and they are mistakenly taken as for viral warts, and not much attention is paid to it. So these are the warning signs, but for us endocrinologists, we may take them as signs, but symptoms obviously will not be there. For example, lots of hunger, thirst. But sometimes what happens is that in a pre-diabetic, they may have extremes of hunger. That is because of insulin resistance, but I think that would become too scientific for the public in general. But if someone has lots of hunger and the after meal sugar is lesser, I repeat, after meal sugar is lesser than the fasting sugar, then there is an impending sign that this fellow might land up into pre-diabetes and later into diabetes.
All right, so those are some indications. Now, Dr. Bhograj, how can someone with excess weight and pre-diabetes then reduce the risk of developing type 2 diabetes?
When we're looking at obesity, that's one of the highest and the most common reasons why we tend to see pre-diabetes as a risk factor. And the key, once you are diagnosed to be in this level of pre-diabetes, losing weight, almost 10% of your body weight when they diagnose you to have pre-diabetes, helps you get on the preventive path. And that is the most important aspect. So if you have a higher BMI and say, for example, you are 100 kgs, by getting your weight down by 10 to 15 kgs, you reduce that risk. And the mantra is extremely simple. So first, identify where you can make these changes to help you lose weight. So diet and exercise is paramount in that. See where the excess calories are coming, make a plan. And then when it comes to physical activity, we definitely have to look at how we are, how active you are throughout the day. So once you make your lifestyle assessment, because this journey of pre-diabetes to diabetes, there is not many. It's most of the time it's asymptomatic. So you need to be proactive. So look and analyze what is going on in your lifestyle, and then make a plan. And the simplest mantra is to be active. So what the recommendations also tell us, around 150 minutes per week is what the minimum recommendation is according to the guidelines. And then along with that, you need to also incorporate aspects of helping improve your muscle tone. And so these are components that we need to look at. Then the other aspect of what we're looking at with lifestyle is definitely dealing with stress and your sleep patterns. So all of these points will help you optimize your lifestyle, help you lose weight, and be on a path to remission when you're diagnosed to have pre-diabetes.
All right, and staying with, action we can take to reduce our risk for developing full-blown diabetes. Dr. Vignesh, should a person reduce carbohydrate consumption if he or she is pre-diabetic?
Yeah. So to preventing the progression of pre-diabetes diabetes, two most important things a person should follow. One is exercise. That is already explained. It is 30 minutes per day, approximately 150 minutes per week. It is a rough estimate. And the second intervention is again a very important. It's a dietary and behavioral change. So when we take Indian diet is predominantly a carb-based diet. So most of in both urban and rural and northwest, southeast, most of the Indians consume 80% of calories through carbohydrates. Either it can be a wheat-based or a rice-based diet. So the predominant, we advise our patients to restrict the carbohydrate to 50 to 60% overall. And most importantly, among the sugars, we always try to tell them to avoid simple sugars like sweetened beverages or fruit juices. While having a meal, we tell them to avoid this kind of beverages or juices. Instead of, they can take water. So carbohydrate restriction is an important dietary intervention we advise this patient. In addition to carbohydrate restriction, we tell them to restrict the fat to 30% of calorie intake, and protein has to be in moderation of 20%. And the next most important thing is increasing the dietary fibers, especially vegetables and fruits. So 2 to 3 servings of vegetables and fruit is a must per day, because taking dietary fibers will increase the satiety of an individual, so that the extra amount of food or calorie intake will be reduced. So restricting carbohydrate, increasing the dietary fiber, and moderating the fat and protein is the key dietary intervention that will help the patient in preventing the progression.
All right. Now, Dr. Kapoor, once you are diagnosed as pre-diabetic, what is the best way to manage it? And is it compulsory that you have to take medications?
Okay, so once you are a pre-diabetic, there are two medicines which need to be taken. One is diet, one is exercise. See, anyone can pop a pill and anyone can write a pill. But I think exercise and diet are the two most difficult medicines to take and to comply with, particularly in the context that you have to do it lifelong. And I think Dr. Vignesh raised a very valid point that barfi and roti are not the same, right? So sweets are simple carbohydrates, and roti or chawal are complex carbohydrates, and obviously they can be taken in moderation. There is no doubt about it. In fact, carbohydrates are your body's currency. Here, I would also like to raise a caveat that consuming 300 calories less is much, much simpler than burning 300 calories. So you must, in general, avoid calorie-dense foods. And calorie-dense foods are carbohydrates, the simple ones, right? The sweets and the fried stuff. So, for example, chicken is so healthy, but fried chicken negates it all. These things should be borne in mind. The other is exercise. Now, 150 minutes a week is fine, but we Indians have lots of insulin resistance, which means that insulin in our body cannot act the way it should. And therefore, we need much more weight loss than the Westerners, particularly at our belly level, which we call the visceral fat in our scientific parlance. Exercise, yes, any exercise which builds up your muscle mass is more than welcome, because at the end of the day, the muscles are the ones which consume most sugars, and therefore they will put a lesser load on your pancreas. As regards reversal, yes. So if you lose 10% of your body weight, as was pointed out earlier as well, there's a huge chance of going back from pre-diabetes to a non-diabetic state. Now, why this pre-diabetes? I mean, it has no symptoms. So it is the point between diabetes and a non-diabetic person, which means that a pre-diabetic person has more risk of a coronary or a heart event and a brain stroke event as compared to a non-diabetic. Agreed that the pre-diabetic patient might not develop kidney or eye ailment, which is common in diabetes. But yes, people can still get a heart issue or a stroke issue. And that's why pre-diabetes is a distinct biochemical entity now, which cannot be ignored. We see so many patients who say, yes, last year at this time it was 6.1 HbA1c and now it's 9.5, because 6.1 has been ignored earlier. So I guess that pre-diabetes should not be taken lightly for two reasons. Number one, it may be a harbinger for complications. And secondly, if you take it seriously, you can go back to a non-diabetic state. So these are the two things which I want to highlight. Yes, medicines required, diet and exercise, no pills are required.
All right, diet and exercise is one way to counter, for developing full-blown diabetes. Well, lots more questions to ask the doctors. We'll slip into a short break and come back with more. Stay with us. Welcome back. You're watching Health and Wellness, Myths versus Facts, and we're talking about pre-diabetes and how it's crucial to detect it to prevent developing full-blown type 2 diabetes. Well, let's go back to our doctors. And Dr. Bhograj, how often should a person check their blood sugar if he or she has pre-diabetes?
So this is a very, very tricky point because as we have clearly highlighted, most of the time this is going to be asymptomatic. When you look at guidelines, the guidelines will tell you, please check once a year, once you've been diagnosed to have pre-diabetes. But again, in an Indian scenario, there is an option for us to test more frequently. And I do encourage people to be more proactive once they get to be diagnosed to be pre-diabetic. And why do I say this? Because in this pre-diabetic stage, it is your given chance for you to convert yourself. So the minute you go into a diabetic stage, your body starts to react in a different fashion. So in a pre-diabetic stage, the diabetes has not yet started. So what I would recommend, every 3 months, make a lifestyle assessment. And as I mentioned earlier, start forming goals, good, healthy goals, whether it is changes that you need to make in your eating pattern, changes in your physical activity. Start making those goals and start looking at it from a 3-month interval. So that is how I would like a person to be evaluating their pre-diabetic condition. Another challenge you will see in pre-diabetes, because when you do your blood tests or the A1C, your numbers may seem, maybe in the normal range when you're doing a random checkup. So you don't often tend to pick up those aspects. So we are using technology now, and devices like the continuous glucose monitoring systems help us look at diabetes in the form of patterns. And when we see these patterns, we see normal and abnormal patterns, and so we can easily help you understand the correlation of what is happening in your lifestyle, what you're eating, and how your body is behaving. So once you have this knowledge, you have to make kind of a plan and start achieving those goals, because being in the pre-diabetic stage is your God-given chance to prevent the diabetes into the next level. And checking and making a plan once in 3 months is what I recommend. But most of the guidelines will tell you once a year, which again, if you have a chance of evaluating yourself and evaluating your lifestyle more often, do it, because this is a very, very crucial moment. And the more proactive you are, the better the chances of you achieving your goals, healthier goals, and reversing your condition.
That's right, a very crucial period to prevent that full-blown diabetes from developing. Dr. Vignesh, should people with pre-diabetes avoid certain types of exercises? I know we're talking that people should do more exercise to stave off diabetes, but which are the safe exercises for people with diabetes?
Yeah. So other than dietary modification, so the second thing we advise the patient is a regular exercise. So 30 minutes of physical activity, aerobic physical activity, which include walking or light jogging, not running, light jogging or swimming, cycling, or a team sport or a dancing kind of thing. So minimum 30 minutes of exercise 5 days a week, which comes around 150 minutes per week. And stretch exercises they can do twice or thrice a week. We generally tell diabetic patients or a patient with heart disease to avoid a certain kind of exercise. Most importantly, strenuous exercise like heavy weightlifting or jumping. Jumping can produce impact to the joints, especially elderly people, those with the neuropathy. They may have a problem with the perception. So we tell them to avoid jumping or heavy weightlifting kind of exercise. And most importantly, when anyone who goes for a walking or a kind of physical activity, they should wear footwear, adequate fitted footwear. So barefoot walking is not advisable. And for beginners who really want to lose their weight, so exercise helps in two ways. It will bring down the sugars, it will bring down your weight. So two bonus. So for beginners, we generally advise them to start with 20 minutes per day. If they can do it in one go, they can go do it, or they can split it 10 plus 10 minutes morning and evening, and gradually every 2 weeks increase by 10 minutes. And for any person who wants to lose weight and who wants to reverse pre-diabetes, we advise them gradually increase the physical activity up to 60 minutes per day. So 60 minutes of exercise definitely bring down the weight loss, and it helps in two ways. One, it reduces the weight and it reduces the sugars. And one more thing we generally tell, we have a behavioral change, mean adding physical activity to the routine lifestyle. For example, instead of taking a lift, one can climb the stairs. Instead of taking their two-wheeler to a nearby shop in the next street, they can go by a walk. So adding a behavioral change will help in long-term benefit. And if someone has a smartwatch, they can see how many steps they can walk. They are doing daily. So it is advisable to walk for at least 8,000 to 10,000 steps per day. So we tell the patients to incorporate their physical activity as far as possible in their lifestyle, in addition to their routine scheduled exercise.
All right, that's important. Like little steps can go a long way, and changing certain things in your routine. And yes, I think a lot of people count their steps, and it should be encouraged that more and more people do that. Dr. Kapoor, does late-age pregnancy lead to pre-diabetes, as women go through a lot of hormonal changes due to late-age pregnancy?
So pregnancy is a diabetogenic state, as they call it, and the various risk factors involve family history, polycystic ovary, which now the laymen call as PCOS, late age. So in fact, in Indians, if someone conceives after age 25, they are prone, and especially with working women conceiving as late as maybe 35 or 38 years of age, it is a big risk.
Doctor, just to interrupt you, just after 25, it's already considered late stage pregnancy?
In the Indian context. So I'm not saying late stage. I'm saying over age of 25, they are at higher risk. Okay. There's nothing as a late stage pregnancy, no. So, but yes, and so there is this. So this is the risk of gestational diabetes. So leave alone pre-diabetes. Besides in pregnancy, for pre-diabetes, there's a term called the gestational glucose intolerance. And that is that if after glucose, the sugars are between 120 and 140. But I don't think we should be going into all this, because the general public may actually get panicked about it. But yes, if someone is obese, has a family history, has had a previous diabetes, has had a heavy baby, which is more than 4.5 born to her, then 4.5 kilograms born to her, such is the patient who is at risk for pre-diabetes as well as diabetes later in life.
All right. Well, thank you so much, doctors. And yes, no need for panic either, but many steps that one can take to, prevent that full-blown diabetes from developing, and also detect if you are pre-diabetic, which seems to be the key here. Thank you all, doctors, for joining us, and thank you all for watching. Goodbye.